Well, has COVID-19 made you a chronic worrier? Many of you might be worried about your finances, your health, or your family. Joining us now with some tips on how we can better control this emotion is Dr. Shimi Kang. Hi, Shimi.
Hi, good morning.
So, Shimi, some people might not know, but worrying can actually suppress our immune system and can lead to much bigger problems. Can you tell us more about this?
Yeah, so we get into a habit of worrying and we think it's not, a big deal. It's just part of what we do. But in fact, worry actually triggers our stress response. It releases cortisol, which reduces our immunity. And not just that, in the long term, it can set us up for mental health issues and really create a life where you're not having the joy and enjoying the moment, but you're chronically thinking about the future or worrying about the past.
Not being fully present, too, is really important. So how do we know when worry becomes a big problem, like an anxiety disorder?
So there's several ways. The most obvious is when your body starts telling you. So if you were to have panic attacks, like your heart rate is going fast, you're sweaty, shaky, your body is really feeling that anxiety, that's definitely a sign. But it could also be more subtle. It could be things like fatigue and just feeling like you have a headache or stomach aches, you're just not feeling great. That's another sign. But the key is when worry starts to interfere with those important things you need to do every day, whether it's take care of your home or your kids or your work, or you're not going out, that the worry is impacting your day-to-day functioning. Then it could be a generalized anxiety disorder or panic disorder or social anxiety. There's many different types, but it's time to talk to your doctor.
And it's so easy to get caught up in the worry right now. There is so much uncertainty about the future. Is there anything we can do in the meantime to dismantle this emotion altogether?
So we have what's called a negativity bias in our brain. We have a sense where we look at things a bit more negative, and it's more sticky than positive. So one of the techniques is called cognitive behavioral therapy, and there are quite a few programs online, including the Canadian Centre for Mental Health. There's an app called Mind Shift, which I tell my patients, MINDSHIFT, which is really helpful. And what the basis of that is identifying automatic negative thoughts, automatic thinking traps or worries, looking at them objectively, saying, what is the evidence this is true? Often our worries aren't based on truth in the sense of, or a little bit of truth. So you're worried about getting COVID, but you don't have any risk factors. You're otherwise healthy. You're taking all the precautions. The risk in that sense is much lower. So looking at the worry objectively, asking yourself, what's the truth behind it? What's the evidence? And then bringing in counter thoughts. So positive thoughts, looking at, what is going well. So those looking and taking the time to really understand your own thinking habits can be very effective.
Great advice as always, being aware of our behavior and trying to stay positive. And as we talked about this a few weeks ago, meditating also helps. Thank you so much for your time again this morning, Shimi.
Thank you.
All right. It is